That worked. Okay. Hi, everyone. I'm thrilled to welcome you to our workshop. We are okay. Hi, everyone. Sorry about that. I was getting a bit of back got from the YouTube. So let's start again. Hello, everyone, and welcome to the AIDS Network workshop reflecting on World AIDS Day. This event is one of a series of events at the AIDS Network during AIDS Awareness Week. And we hope you will also join us for the World AIDS Day Vigil, which takes place tomorrow at 6 p.m. This morning, we're fortunate to hear from a really special group of people who will be sharing their experiences living with HIV and reflecting on how we can best support people living with HIV now and in the future. I'm thrilled to welcome our workshop facilitator, Believe Deliwayo. Believe is a long-term survivor, 22 years living with HIV. He has a Bachelor of Science in International Development Studies, a Bachelor of Health Studies in Healthy Policy. He has over 10 years of experience in the NGO sector, working as a manager as well as on the front line. He has done forced migration and trauma counseling studies and advanced mental health counseling, which he has usefully integrated throughout his work and participation in various developmental activities and ASO-related work. Believe has lived, interacted, and worked with men, women, and children from diverse backgrounds in both developed and developing countries. He holds numerous academic and professional development certificates in addressing sexual reproductive health and rights, HIV and AIDS, and has worked with UN agencies like WHO, UNAIDS, and UNESCO, to name a few. His last 3 assignments, Believe worked as a technical advisor to World University Canada in Malawi on a project funded by the Department of Foreign Affairs in Canada for 4 years, as well as ADRA in Cambodia for 2 years. Believe worked at Black Cap, where he initiated settlement programs for people living with HIV and people who are LGBTQ in Ontario. He currently is a board member at the AIDS Network, as well as a full-time trustee for SEIU Health Local 1 in Ontario. He is married with 4 biological kids and 3 adopted children. And if that doesn't keep him busy enough, he's also pursuing his Master's of Science in Health Studies. So we're so thrilled to have Believe joining us this morning. So before I pass things on to Believe to get us started, I'm just going to go over a few housekeeping details. We'll be thrilled to answer any questions that the audience has at the end of our panel discussion. So if you have questions during the discussion or afterwards, please type them into the Q&A box and we will answer them at the end of the panel discussion. Just a reminder to please respect our panelists using respectful language in all your questions and comments. And if you find the content of our discussion disturbing or triggering, please don't hesitate to take whatever steps you need to take care of yourself. So you can call here 24/7 at 1-888-437-3247. I'll put that number in the chat so you can have it there. Or you can contact the team at the AIDS Network at 1-866-563-0563. So with that, I'm now going to pass things on to Believe to start our panel.
Great. Thank you so much, Jillian. I know most of you know Jillian. She's an amazing supporter in for people living with HIV and great passion in addressing HIV and AIDS. And I'm so excited to be with you here. It's a World AIDS Day, and taking moments to reflect. So what I'm going to do right now is do the land acknowledgement. I'm going to read it out here. So we acknowledge the land upon which we are located as the shared traditional territory of the Haudenosaunee and Anishinaabe peoples, protected by the dish with one pound belt. This historic peace agreement between the Iroquois Confederacy, the Ojibwe, and allied nations represents a commitment to share and protect the land, water, plants, and animal with respect. We wish to honor the original peoples of this land and express really great gratitude for the opportunity and privilege to work with communities across this territory. For without them allowing us, we would have not been here. So we would want to acknowledge that in so many ways. That's our land acknowledgement. I think it's important. That piece is, I think it's really important for us to be able to acknowledge and have that piece. For me, I was saying to Gillian, it's more like a prayer. So it's really important that we do those acknowledgements, not just as a way of just saying them, but really have a feeling, feel that really where we are, it's the lands that we are privileged to be, and it's really not a right, but I think it's a privilege that is extended to us. So we really are very grateful. So what I would want to do right now is to introduce our amazing speakers for the day. Just like what Gillian was saying, for sure, do prepare your questions that you have. Our panel experts in addressing HIV and AIDS issues, and they'll be able to respond to those questions. So whom do we have today? I have an honor to introduce to you Tracy. So Tracy has been living with HIV since 1992. She has been incarcerated and has lived with addiction. She previously worked with the Toronto People with AIDS Foundation and Prisoners with HIV Support Action Network, PASAN, doing amazing community outreach work and education as well. She currently lives in Hamilton with her husband. She has 2 amazing children and 4 grandchildren. No, she looks 25. Look at her. It's like she's been taking care of herself very well. Tracy, we are so thrilled to have you today, sharing your experiences. I can't wait to hear what you have to tell us. We have got April, wearing glasses like me. April Bullock is 40 years old. She was diagnosed with HIV in 1997. She was previously incarcerated. She has been a part of the AIDS network since 1997. So the moment she realized it, she jumped on and became part of the network. She has a 20-year-old son with special needs. April believes in the importance of education about HIV and AIDS, and that no one should be discriminated against or incarcerated because of their health condition. Thank you so much, April, for being with us here. Living with HIV and having a child with special needs, it's a huge, big gig. So would like to acknowledge your presence here today, and I can't wait to hear what you have to share with us, your experiences as well. And then we've got Jose. Jose, there you go, with glasses right there. I think I've crossed paths with Jose at some point, I think 2006, 2005, we were just chatting about it before we started this workshop. Jose was diagnosed in 1985 with HIV, and has been a strong advocate for other people living with HIV since 1992. He believes that in order for change to happen in the disproportionately high rate among people of color, we need to address the stigma of HIV, definitely. That continues to create barriers to treatment, testing, as well as misinformation about HIV. Jose, thank you so much for being with us, and I see your great passion there to address those misinformation. So we are so grateful that you are here with us today. And last but not least, all in red colors, definitely the passion, it speaks for itself, is Chris Morrison. Chris is a 50-year-old male whose pronouns are he, him, just like me, and his, and is a member of the LGBTQ2 plus S community who identifies as gay. His HIV diagnosis occurred 20 years ago in 2001. He's a member of the AIDS Network and a former member of the board of directors. Chris is a resident of Norfolk County and is currently undertaking a career path changing from emergency health services to the social service worker diploma program at Pashwe College. Yay. He proudly declares that through extensive work and efforts to be 4 years and 1 month living a program of abstinence recovery from substance addiction, Chris believes in unity through advocacy, education, to dismantle stigma and discrimination associated with HIV, addictions, mental health, and the LGBTQ2 plus S communities. So welcome again, welcome everybody for joining us today. And these are our amazing 4 panelists who are going to be sharing with us. And so just to let you know that World AIDS Day is a day that we take time to reflect and look into the future in terms of living with HIV. Some of you, as you might know, so many things have happened, right? The last 2 years, we've been on lockdown. We've never had an opportunity of meeting in face-to-face as we normally do. I would like to acknowledge these folks who have been living with HIV for a very long time. And to me, that shows resilience, a passion of life, and a zeal to inspire others to be able to live positively. And I think it really to inspire the young generations using those experiences on how to address HIV, especially stigma. So, having said so, I'm gonna, Jillian, is there anything else that you thought you wanted to add?
No, I think you've covered everything perfectly. Thank you so much. I'm going to turn off my video and let the panel proceed. Thank you so much.
Okay,
thank you, Juliet.
I'll still be here, just behind the curtain.
Okay, thanks, Julian. All right, so I'm gonna what I'll do is I'll be asking some questions, and you know, each one of you feel free to really come in and much as possible feel free to respond and to say as much as you can. And if you are uncomfortable answering questions, just tell me. Believe I'll let that I'll pass on to answering that question. And again, just to remind those that are live on YouTube with us that there are certain questions that maybe can trigger issues with you, and try as much as possible, just like what Gillian said, to seek support wherever you are, or to excuse yourself, to take a moment. I think that's greatly appreciated as well. Self-care, I think it's really important. So I'm going to ask a question here. What does World AIDS Day mean to you? What does World AIDS Day mean to you?
For me, I feel it means it's a time for me to reflect on back when I was diagnosed on that day, and also to remember the people that I have lost, and for the hopes for the future for a cure. That's what it means for me.
Similarly to Tracy, for me though, it also means that it's a reflection on how many millions of people have died because of HIV. It also helps me to remember at times government's inaction to respond to something that was, labeled to be specific to a community, and hence why there was a slow response for government to provide the kind of support that was needed in the early days. I think though, from a broader perspective, it sort of helps the community as well as others to recognize that this is an issue that has happened here in our country and globally as well. But it's something that we need to constantly be reminding others that we need services to continue to support people living with HIV, and as well as educate people who are not exposed in terms of what it is for others to be living with such a dreaded disease. It also reminds me that at one point, and still, we have been criminalized for simply being HIV positive. So it's a day of reflection of a lot of stuff that could be unpleasant, and you know, it's more of a mourning of the souls that we have lost.
Mhm.
Powerful.
Yeah.
Yeah, I'll go next. Yeah, what does it mean to me? Like everything that has been said already. Yeah, just the title World AIDS Day. It's bigger than just a problem in this area in Ontario and Canada. It's a global issue, and it's a global issue that needs to be addressed and tackled. I agree with Jose, definitely, that it is a day of remembering, as well as Tracy. Yeah, remembering and honoring those that have died because of HIV and AIDS. And it's definitely important to reflect on the past, on the present, and where we are going in the future. And again, tying into the global aspect of things, this is a global issue. There's a lot of inequity as far as access to medication goes. And in this day and age, this should not be a problem. So it's just a reminder that, yes, HIV still exists. People do still die of AIDS globally. And that's something that should not be happening in this day and age.
Amazing.
Guess it's my turn now. World AIDS Day means to me an opportunity to reflect on the lives that we have lost, to celebrate those that are still living with HIV and AIDS. It is an opportunity to educate communities about HIV and the progress we have made, and to reflect when it comes to medications in an effort to stigma, discrimination, treatments, those living with HIV, the importance of criminalization and being incarcerated. And that's what World AIDS Day means to me.
Awesome. I love the responses that all of you really gave, and you were able to reflect on different aspects of what it means to you. And that's really amazing. Really remembering our loved ones that we've lost because of HIV. And that's Tracy, I'm hearing from you. Really, really, Jose, you say it's the time to mourn. And really, Chris, you're saying it's a global issue. HIV is no longer just a regional or a national issue. We live as a global village right now, and it's a global issue, and really time to look at inequity issues and issues to treatment to access. And for you, April, really, it's about celebrating life. We have come this far, living with HIV for so many years. Powerful stuff. Really amazing that we have been up to here living with HIV, and so really reflecting and looking at those that we've lost, but also I think an opportunity to keep on educating young ones, the future generation, that they do not experience what we experience, and continued advocacy in doing this work. Thank you so much. It means so much for you guys. It means so much for me as well. So having said so, now I want you guys really just to share briefly what was it like living with HIV in the early years of the pandemic? What was it like living with HIV, really living with HIV in the early years of the pandemic for you?
Yeah, I can start with that. I think it wasn't about living with HIV back then, it was waiting to die back then. Because when you received a diagnosis, you were either told that you have about 2 to 5 years. So the concept of living with HIV did not exist. It only existed later on. It was really disastrous because you couldn't get away from the multitude of people dying of HIV. Um, it had been focused again on one community, which was the LGBTQ plus community. And because of that, there was a slow response. So there was nothing to turn to, nothing to support until people within the community themselves started to do a lot of advocacy work. And even that met its own challenges, opposition from other communities within the Greater Toronto area was opposed to giving a particular group the kind of support that we needed, or that government funded should be filtered into these areas. A lot of these agencies that started back then were started by regular people because they saw a need for the support prior to other agencies, nonprofit organization, medical health services, and so on getting involved. Even doctors were refusing to meet with HIV positive people. They were so little known, and I think the whole learning curve back then, that people who were living with HIV and the medical community, we all were growing at the same time. Like the same information that was coming to them was also being filtered back to the community. And it was a long process, but it didn't stop the deaths. It didn't stop the infections. There was no uh, sort of manual in how to deal with or stop the infections. And again, it was either you had to be gay, you had to be a drug addict, you had to be a sex trade worker, because back then that's the world saw that's the only people that were being infected, which was of course we know today is not true. I myself was waiting to die um, because when I got diagnosed back in '85, there wasn't any medication available until the early '90s, I think around 95, 92, 95. That AZT came on the scene, and even that wasn't a guarantee of anything. It was a sort of recycled medication, but it did give people a sense of, at least I'm taking something to prevent me getting sick. But the illnesses that we were dying from was just extraordinary. I mean, it was so visual, like when you saw someone on the streets, literally you sort of knew that this person had AIDS. People didn't refer to, oh, you were HIV positive. People called you a person with AIDS. You had AIDS once you were infected. I don't think the media helped at all. I think the media sort of, you know, endorse a lot of the stereotypes and a lot of the stigma that we live with today. So it's kind of hard to get rid of it unless we do, education. But it was an awful period. I've lost a lot of friends. At 26 years old when I was diagnosed, my life in terms of the people I'd lost was like someone in their 80s.
Wow.
Like when you're 80 years old, you expect to lose people, you expect to lose loved ones, you expect to lose friends because you're aging. But at 26, to experience that, um, apart from just being positive and worried about when you're going to die, but you also see people you love die. So it's, it was a stressful time back then, for me at least. And a lot of my friends as well that I knew, you know, then you're pretty much left alone because you have no outlets. You're afraid to tell family. I remember thinking I was praying that my grandmother would pass before I do because I didn't want it to feel ashamed that I died of a disease. It was one of those things where you wanted your parents to, not see you in a condition like that. So it was a tough time. Yeah.
Thank you so much, Jose, for sharing. That's really amazing. Really a lot of challenges there that you have outlined, and your experience is really quite inspiring to some of us having to go through all those challenges. What was it like living with HIV in the early years of the pandemic for you guys? We've just heard from Jose. Anyone?
For me,
I'll quickly go next.
okay.
I just want to say this is one of the questions that I am going to kind of take a back seat on, because I was diagnosed in 2001. That was just 20 years ago. I know that that's still a long time. However, listening to Jose and I know Tracy and April have a lot to contribute to this question specifically. So yeah, I'm just going to take the back seat and not take away from these people that have very powerful stories to share on this question. Thanks.
Awesome. Tracy, you wanted to speak. Sorry.
Oh yeah, no, I thought is my microphone unmuted? Can you hear me?
You're unmuted. Yes, that's right. Yeah.
Okay. I feel kind of cheated. I thought Chris was going to share more, so I've got my seat waiting. But anyway, for me, started in November 1992. I was incarcerated when I got tested. Being I was 23 years old, and my whole experience of being incarcerated and getting tested because I was with somebody that before I just gone to jail and I was using drugs. Yes, I was the drug addict, struggling. And I'm just getting a little bit nervous here. 1 second. Focused. So
that's okay.
It's been a long time. And honestly, I never thought that I would be here today. I thought when I was told that was the end, like I thought I was going to die in a short period of time. There was a lot of shame around it. Originally, when I was told that I had no confidentiality in the jail that I was in, I was pulled off the range where other women were watching and taken into a room with a public health nurse. And she sat down in front of me and she said to me, "Do you use drugs?" And I was like, "Yes." And she says, "Well, you're HIV positive. You need to get help." And I just looked at her and I'm like, okay. And then she proceeded to ask me people who I had been with, the people that before who I'd used drugs with, who I had sex with, and wanting all these names. And I just shut down. I went into shock and I was very angry. And I just basically looked at her like, and had nothing to say. And she's like, "Well, you can cry, you know." And I said, "I don't want to freaking cry." Like I was just in shock. So she got a little scared and ended up leaving. And I wouldn't give up any names. I thought, you know what, I'll deal with it in my head myself. So I just walked around the room and thought like, oh, I'm going to die, and that was just terrifying thought. And then from there, the institution had me shipped out the next day because they didn't know how to deal with it. They took me to another jail where it was all women, and they put me into a cell by myself on a treatment cottage that I never agreed to go on to. They just put me there, where originally you have to ask to want to go there to this treatment cottage in Vanier and Brampton. And they ended up putting me into a room, isolating me, putting me by myself, where the women are on a waiting list to get a room by themselves. So then that just centered me right out, where everyone was like, "Whoa, okay, well, what's with you? Why do you get to sell on yourself?" I mean, it was just, there was no confidentiality. It was just horrible. And then disclosing to my people, like to tell people, I ended up calling the guy that I had been with last. He died within 7 months. It was February 93. I was told July 93 he passed away. And I really thought, like, there's, I'm not going to live. I had 2 children that I had thank God, before I became positive. So they were never positive. And then going from there, the whole institution stuff, it was just hard for me. I'm losing track.
Wow, that's an amazing story.
Yeah, sorry. I get emotional just like thinking back to it all, like how terrifying it was, and just the whole shame around having HIV and having no one to talk to. I ended up, Passan came in from outside into the jail. So that was Prisoners with HIV and Sports Action Network in Toronto. They came in and they were doing outreach in the jail, which was awesome. That's where I got connected with them. And then I ended up getting out into Toronto, rolled to Toronto. So that's where I lived. And then I ended up going into, you know what, I skipped a part, because with treatment part, in the beginning, they also, when I was incarcerated, came and they gave me the AZT, the medication. And that's when I was like, you know what, I went and seen the doctor, and then got the medication and was like, I'm not taking it. So I ended up like dumping it in the garbage. I was like,
Wow.
I'm not doing this. I turned to my faith. I started to pray to get through it. And that's where I avoided medication for the first 10 years of it. It's been 29 years that I've been positive now. And I just turned to my faith in the beginning before medication. And then I ended up going on the medications afterwards and had some struggles with that. Not so much, I didn't have any reactions to the medications or nothing like that. I'm getting defocused and nervous. I feel like I'm bringing up more personal stuff where I'm losing track of where we are. So I think I'm just gonna stop right there.
Awesome.
Okay.
Tracy, thank you so much for sharing. You know why I didn't want even to interfere while you were speaking, because you sharing, I think, amazing experiences that any one of our viewers might resonate with, and might have walked that. Like, your experiences are extremely, extremely great and would impact in so many ways, especially with the young folks. Just to know how strong you have been, and to see you smile and look so young and so strong, and just reflecting on those experiences tells more how much passionate you are about life, and seeing that our future generation, and being a grandmom, really, I can see that you would want more for your grandchildren. Your experiences are amazing. And Chris, thank you so much for sharing with us as well. This is why it's very difficult when you're the last person to speak. You're kind of like on the spot. April, do you have anything to say? I don't want to put you on the spot there. I don't want to pressure you at all.
Your mic, April.
Your Mikey.
Now can you hear me?
Yes.
Okay, when I was diagnosed in 1997, I lived in a group home. I was hanging out with the wrong people. I was drugged and raped. And then I found out I was HIV positive. I didn't know how to feel at the present time. The people that I told everybody else. So it's like my disclosure got passed around like it was rumors. And then in 2010, I was incarcerated because of not disclosing my status to my previous partners, and a family member actually put me in jail, which was unfortunate. I spent 16 months in jail. I was in segregation, not in the population of the other people incarcerated. I was by myself, alone. I didn't know what to do. Then I ended up getting out. I lost everything, my apartment, everything I owned. Ended up on house arrest for 4 years. I did a documentary on Unlocking HIV, and I told my story on there. If anyone would like to check that out. I had to live with my parents. My dad previously passed away. So, and my son I have a special needs son who keeps me motivated and keeps my head up and keeps me living every day. And that's all I can live for right now. And my partner that I'm with right now is the love of my life. So I just have to hope for the best and, move forward every day.
One of the things that that really touches me is being incarcerated because of one status, right? Like you did not know about this, you didn't bring up this upon yourself. Like what is happening in the world, and I think we see this happening over and over and over. Thank you so much, April, for sharing, and what a great story, and a strong mom being there for your child and having gone through those experiences. I'm sure Jose and Chris, you can agree with me that Tracy and April being incarcerated, it's just one of those things that are very devastating. And again, we're talking about the rights of women, right? And being blamed. And we know that women are more vulnerable to HIV than it is to us guys, and having to go through and experience that is really devastating. But I'm so grateful that you guys are so amazing. If you guys would want to look at April's story, the link is just in the chat there. You can click it, you can copy it and click it and be able to watch it. And all your experiences are so unique and very different and very touching and very empowering, especially for me. And living with HIV for the last 22 years myself as well. Given 2 weeks to live and almost dying because someone thought I was going to die. No hope for the living at all. Rejected by family at some point in time. Lived in the streets, became a street beggar. And you're talking about this is in Africa, in Southern Africa. Mention of Southern Africa, you know what that means right now. And stigma being so high, but I'm so grateful that I was able to live through that, and being able to meet with each one of you and your unique experiences just really gives me the hope that one day, I think if we keep on pressing on, we will be able to go through these challenges. So let's continue. Thank you guys for sharing that. That was for me. That was powerful. That was really powerful. So I know that some of you already touched on treatment when you started on taking treatments, and for you, April and Tracy, I think you've shared a little bit more about when you already started treatment, when you're being incarcerated. You already shared those experiences. I don't know, like any one of you, between you, Jose and Chris, if there's anything that you want to add, or any one of you, if April or Tracy, if there's something that you want to add about what it was like when you started treatment and participating in trials. So I'm asking the third question. If you've got anything to add, any one of you.
I'll go first on this one. Yeah, as I said, I was diagnosed in 2001, and it wasn't until 2005 or 2006 when I actually started any sort of treatment. When I did finally start treatment, the one drug that I was on, it was a drug trial at the time. To this day, I remember the drug trial number. It was MK0518, and that drug later became known as raltegravir, and I believe it's an integrase inhibitor. So when I first started on medications, I had a lot of fear. I was working in emergency health services in a call center, like a 911 call center. And I had the fears of having GI issues and having to go to the bathroom a lot, and you can't just walk away from your desk. So I had a lot of fear around work, and it being known at work that I was HIV positive. So a lot of fear and apprehension in that regard. So this trial medication, and there were 2 other medications, I don't know which ones they were, that were already out on the market. So that provided the 3 different classes of medication. My progression on it, it did virally suppress me, but at some point after I'd started it, some point I think in 2006, I ended up having Kaposi sarcoma show up on my lower legs, and my CD4 counts were pretty good, and viral load was low or undetectable. So Kaposi sarcoma should not be showing up in that situation. In that situation, so I ended up being pulled off of the trial medication after my doctor couldn't figure why I was experiencing that. So, and also I was kind of happy to come off of that, because the trial medication, it was I think it was 4 pills at 3 times a day. So there was 12 to 16 pills I was taking throughout a day. And that was really hard, having to take pills that many times a day. Not like it is today, where I wake up and I take 1 pill in the morning. And so, yeah, my early experience being on treatment, it was very intrusive. It was not desirable. I did end up having some GI issues in that from it. So, yeah, I think that's all I have to say on that question. So I'll let somebody else share.
I just wanted to kind of jump off where Tracy kind of left off about the AZT. Because when I was first introduced with AZT, I had to take 6 in the morning and 6 in the evening. And then they had, later on, they added, I think, 3TC to that. And they just kept building on the amount of pills that we had to take during the very early years before 2000. And I was up to about 40 tablets a day that I was taking. And the earlier medication as well was, very, very large pills, like the Sequenovir and so on. They were very large gel caps. And there was a lot of, I didn't have as much of a side effect from the drug. I sort of tolerated the drug. The problem for me was adherence. Just the idea of having to swallow all these tablets on a daily basis, 40 pills a day, was really very difficult. You lost your appetite, you felt some nausea, your whole function was disrupted by taking the tablets. There was one pill that I had taken that my doctor had prescribed, called abacavir, I believe it was. And that was one of the only tablets I had a horrible reaction to, where you broke out all in rashes. And there was a potential of death with that tablet as well. So the side effects of some of the tablets was really, really difficult on the system. So adherence was difficult. So I would jump on and off of tablets often. Like I would take it for a couple of days I wouldn't take, a week would go by, a month would go by, I would start back. So I was really messed up in terms of taking medication, was really bad at it. And my CD4s were continually dropping. So the lowest count I've been at was 60. My CD4
Oh,
cells had dropped to 60. So not only just the CD4 is dropping, but it means that I could be susceptible to any kind of illnesses. I could get a common cold and develop pneumonia. And that became very serious. That is when I decided, I really needed to start to be adherent. Luckily, the quantity and sizes of medication by the time that that happened, which was around 2004, had started to reduce. So I was able to take less tablets. Today, I'm taking 3 tablets a day, which is a far cry from 40 tablets that I was taking back then. So historically, in terms of the development, in terms of our, treatment, we have really come a long way. And as Chris said, he's taking 1 tablet a day. I'm actually thinking I should connect with you and find out what type of drug is that. But
Biktarvy.
right,
Is it
yeah,
not? That's what I take. 1 pill, Biktarvy.
yeah. So I mean, I'm good with the
Sorry.
tree, I'm good with tree now. But it was tough. Like, I mean, they were just throw pills at you. They were just throw medication at you. And I think in terms of the medical community, they just wanted to see, let's see how that works, rather than it will work.
Mhm.
The doctor I had in Toronto was really good at help his patients understand how medication work. He would pull out his little pad and draw, diagrams and show you how, the reservoir of medication is built up in your system that prevents the HIV from jumping over the wall. So he had a way in which he really was able to speak a layman's language in helping you to understand how your medication works for you. And that helped me a lot in deciding why I had to be, adherent. But adherence was one of the most difficult things for a lot of people because of the quantity of pills that were being shoved down your throat. It was hard. It was really, really tough. You know.
Yeah,
awesome.
and that's why for me in the beginning, I did not even want to take any medication. Sorry for jumping in there. But
That's
I did
okay.
not
Go
want to
ahead.
take any medication because of the fact of how many that you'd have to take. And when because I looked into it, like I read so much way before the first 10 years of not taking anything, but I got as much information as I could all the time about the new medications and what's what from the doctor. And I'd ask questions. She would try to push it on me all the time. You should really do this. And I'm like, I'm not ready. I'm not ready. I'm not ready to take all them. I don't want to be a lab rat. I was just really angry, right? It's in that beginning. So with the medication. So then when I did get on them, thank God I'd had no reactions to the Crixavan cocktail. That was the first one that I got onto. And I didn't have any like side effects. So I was very blessed with that because the reason I got onto it was because my health was deteriorating. I had pneumonia numerous times. I was hospitalized. I thought for sure that this was the end. And my mother begged me to get on medication, and I was scared to die at that point after when this all started happening. And it was like one thing after another, and the doctor was like, you really should do something. So I ended up giving in and taking them, and the side effects were nil, which was awesome for me. And now it's to 1 pill a day that I take, like Chris, which is amazing, as well as my vitamins. So in a way, I'm still taking a whole whack of pills every day with all the vitamins I take.
I just kind of remember getting to a point where don't even bother to ask me the name of the pill. Just tell me the color of the pill, and I'll tell you what I'm taking. Because it was so many. You lost track of what names of the tablets you were taking.
Yeah.
Mhm.
I had
I
no
keep on
choice.
hearing.
Sorry, Tracy.
Sorry, go ahead. I was saying the adherence. I agree with Jose. I had a lot of issues with the adherence, skipping doses, missing them. So I'm just the same issues also. Sorry.
Amazing. I wanted to say, for me, I had no choice. There was no treatment at all. Yeah, so it was a lot of fighting to access medications. And every time I had an opportunity to go on treatment, I was in Zimbabwe then, I would get everyone else go on medication. I became a dissident. Me, Sakakmat, and another friend of mine in Zambia. In Southern Africa, there was no access to treatment. Just as it is right now, we don't have access to vaccination, COVID-19, something else. But we didn't have access to treatment, and I had to live on alternative therapy, just food. And it was really, really hard. But I thank God, when I came to Canada, I had an opportunity of meeting with amazing doctors at Maple Leaf. They took me through taking medication. I refused for I think, I remember sitting down with one of the doctors lecturing me about taking medication, and my mind was still fixated into having everyone else in Southern Africa having medication before I can have it. And they're like, well, we need you alive, right? So you have to take your medication, so to continue to do advocacy work. So I started taking my medication. Right now, I just take one, just like you, Tracy, it was this. So I take Tromic. It has been working fine. I didn't have any side reactions initially when I was taking, but because I really wanted to gain weight, I lost weight so much because of the traveling and so much other social determinants of health I'd gone through. Being a refugee, you don't have housing, you don't have work, and I lost so much weight, and I really wanted something that would help me in just ensuring my immune has been strengthened. So I took 3, and then later on I was having problems with eating, and then I just take one. I've just been taking one ever since, and that has been working fine for me, pretty much. Yeah.
Well, one of the challenges also with medication was traveling. If you traveled, if you went across the border just to the United States and they found the medication in your bag and they were able to identify HIV, you would be prevented from entering the States. If you were traveling abroad, which I had done a lot of during the early years, I would have my doctor send my prescription first to the Caribbean, and have the medication delivered to the Caribbean to interested friends there, so that I wouldn't be detected coming through customs, where if they should check my bag for anything. So even traveling, you had to be, a little mindful about traveling, whether you were going to the Caribbean, whether you were going across to the States, Europe, anywhere you were traveling to, you needed to either conceal it somehow, so that you wouldn't sort of miss your dosage. I'd gone to Australia and I decided, you know what, I'm not taking any medication whatsoever. And for that period of time I was in Australia, I stayed without medication. So it affected a lot of aspects of, who you are. I remember too, one of the jobs that I had, my last job was when I was with the bank. Because I had to take medication and my prescription had to go through the company first before it was approved by the insurance company for coverage. After a while, they started to build a case in order to dismiss me.
Wow.
And it's difficult to prove that you were targeted because you were HIV positive. You can't prove, it's difficult to prove it in a court. I remember contacting the standards for employment where they investigate these cases and so on. And when I spoke to the person and they looked at the type of settlement that they gave me when they dismissed me from the services, the guy said there's no way that they're going to consider that you were discriminated against because of HIV, But even in your job, you had to be careful. You had to be secretive. You couldn't let them know, because the confidentiality in terms of employment was, your business was not kept private. You know, you became a target if you were positive and working, especially if you were working in an industry where, there was this sort of image of themselves, you know? So it was hard. It was really, really hard. I mean, even today, I'm sure there are people who've been discriminated against, because of HIV and so on. And they've been let go and they're not able to come and say, look, I know this is what, they know why they were fired or why they were dismissed. But again, it's one of those things that employers work around. They just work around it.
Yeah. So just listening to what you're saying, I think you sort of like created a pathway to maybe the next question that I would want to ask you, all of you. So I know that we have tried to address it already in some way. I think as we were talking about what it was like starting treatment. So from your perspective, what do you think are the challenges we face regarding education and advocacy for people living with HIV? And I know that on your sharing your experience already, you've touched on this. I just want really to hear from you again, like if each one of you can just start by giving me two challenges each. Like just give me two challenges, like in terms of what are the challenges regarding education and advocacy for people living with HIV? And again, I mean, you can talk about, how it has sort of changed over time. I want to hear why you think also education is important for people living with HIV as you respond to that question.
Can I just speak first about my treatment?
Sure, April.
Have the chance. When I started treatment, I was on various different medications, and I thought my viral load would never go down. It was always skyrocketed. And then I became pregnant. I took medications. So my son is not HIV positive. And thank God for that. And now for many years, it's been undetectable. I'm on one pill. I take Persista. And I'm very glad to say that my viral load has been undetectable. But I remember when I was taking the medication back in 1997, 1998, it was in a liquid form, and I had to inject this liquid into capsules, and it was the worst taste ever. Like I had to take like 16 of these pills, and I couldn't handle it, but I had to, and it was just gross. But I'm glad that I'm on one pill, and I'm glad my viral load is undetectable, and my son is HIV negative, so I'm happy for that. So, and the next question that you just asked about education and stuff, I think people need to learn that HIV and AIDS are two different subjects. Like when you say to someone that you are HIV positive, they automatically think you have AIDS. And that's not it. Like you can live many years being HIV positive, but unfortunately, if you have AIDS, there's only so long that you can live for. So that's what I want to teach, like the young ones and students, and that like there's a difference between being HIV positive and having full-blown AIDS. So those are my two factors.
Great. Thank you so much for sharing your treatment experiences, April, and for your amazing inputs on what you think about education and educating ourselves with the difference between HIV and AIDS. I think it's very important. I love when I hear right now we talk about social distancing and physical distancing. I'm like, it reminds me of the early days of HIV and AIDS where people couldn't differentiate the two, right? We want to be socially connected now. but physically, 6 feet apart, but socially connected from a distance. Right?
Well, I don't know. I don't know anybody who wants to be socially distant sexually. That's for sure. I think that would be difficult. 6 feet. I think that's a bit difficult to achieve anything.
Right.
I agree with Jose.
I think when we look at education and so on, I don't know of any school curriculum where in biology or anything where this is included as part of a subject. I don't know whether or not it's taught from a social perspective and I think it's taught medically, but I don't think it's taught from a social perspective at university level. I don't know. What I do know is that a lot of the nonprofit organization, AIDS institutions have become somewhat complacent. That's how I see it. I see them a little bit being complacent in that they have not continued with the zeal that they had in the past in getting out there to the public and to institutions like the church and the school system and so on to talk about the social implications and the social impact of HIV and AIDS, either with people living on it or people who are affected by the disease. So I think there's work that needs to be done there. We have the material. We have had a lot of research done from different aspects, whether it's HIV and aging, whether it's new infections, whether it's long-term survival. All this material is there. But yet we still have the social implications of discrimination existing, rejection, family values being threatened, religious organizations and their dogma and doctrines, still have a sort of condemnation of people living with HIV and AIDS. So we haven't actually removed anything. All this stigma, all the old ideas about HIV and AIDS still exist. Yet we have all the research material to show the differences, but it's not been implemented. So I don't know why it's not being implemented. And that's why I come back to saying that some of the institutions have become complacent in that we have become too lax and too relaxed around the promotion of education and getting the message out there. It's a continuum. We have to continue it. 40 million people globally are literally infected with HIV. 40 million have died. That's phenomenal. In other words, if you look at it in terms of the population of Canada, every Canadian have died. When we look at what HIV has done globally. So why is education on the back burner today? Why is it not out front there? I'll tell you why. It's because we still believe that HIV and AIDS belong to a certain group of people. We still believe it's only HIV, only gay people. We still believe it's only drug addicts. We still believe it's only sex trade workers. That stigma has not been lifted from the general population. How do we do that? I don't know.
Yeah, I hear what you're saying, Jose, and you're definitely right about ongoing education and training, especially around terminology, from naming people drug addicts to just like substance users, and really being able to be accommodative in spaces where we are, where we live, and view each other equally, regardless of sexual orientation or backgrounds. I think it's really ongoing work that we need to advocate for. Thank you so much, Jose, for sharing. Does anyone else have I want to hear what you think about education and advocacy, the challenges. And
I'll go.
Yeah.
I'll go next. Yeah, I saw a comment in the chat from Johan. Stigma and discrimination is the biggest challenge. I agree 100%. Stigma and discrimination do still exist today, and there are a lot of barriers to educating people, the general public, people that think that HIV does not apply to them, that they're somehow immune to getting it because of the stigma surrounding early, like as Jose touched on, like, yeah, believing that it's just intravenous drug users, gay men, sex trade workers, etc. So yeah, stigma is a huge factor. Myself, stigma and discrimination within the healthcare community is a big issue. I remember 3 or 4 years ago going to get a flu shot, and I was courteous enough. I told the person giving me my flu shot that I am HIV positive. And even though any healthcare worker should be using universal precautions for everyone, the people that I saw her administer their flu shot to, she didn't have gloves on. I told her I was HIV positive, and she put gloves on. So just that simple act of doing that just really reinforces any stigma and stereotyping. So, and it has quite an impact on an individual who is HIV positive. So, yeah, there's definitely a lot of challenges. Advocacy. It's great to see today that there is a movement towards embracing a peer aspect. The AIDS Network has a peer navigator. There's a lot of agencies, mental health organizations, a lot of agencies that are adopting a peer-centered approach. And I think that's very important. It's very necessary. When I was diagnosed with HIV, I really wish that I had a peer that I could have been connected with to help me navigate my early experience with it, because there's so much uncertainty, so many fears, worries. There's just so much that comes with when someone is diagnosed. And yeah, the education aspect for sure. I don't know if it's a sense of the public or society getting a little complacent because HIV is so treatable and manageable today, that I think there's a level of complacency that almost comes with that okay, we don't have to attack or be aggressive on this because it's a manageable disease. People with HIV can live long lives. And I think it's important from an education perspective to really reiterate that HIV does still impact one's quality of life. And yes, you will. One of the greatest challenges with living with HIV today is long-term survival. And that was touched on in a previous webinar, living long-term with HIV and HIV and aging. And there's a whole lot of issues that come with that. So yeah, a lot of education that still has to be done, and advocacy as well. That's my 2 cents worth on that.
Thank you so much, Chris, for sharing. Anyone who's any thoughts on this question?
I just want to add something. I think as Chris was talking, what came to mind for me is the U equal U. When that was rolled out, one of the main concerns I had about U equal U is undetectable, uninfectable. You familiar with that, right?
Yep.
Right. My major concern with that was it being rolled out, how it was being rolled out, which was, even though if you're undetectable, you're not going to infect another individual, but it does not mean that you couldn't pick up another disease or couldn't be infected by another disease. I think in a lot of ways that when I looked at how some places rolled it out, it really took away from the safe sex message as well. So it's not just HIV to be concerned with. We have to be concerned with syphilis, gonorrhea, and other sexually transmitted diseases. As a person living with HIV, it means that the impact of other diseases would be even more aggressive for us because of our depleted immune system. So one of the concerns I had was looking at how the rollout was. It wasn't about liberating you to have sex without a condom, but it made you understood that at least your condition wasn't a threat to the public. And that's all it really meant. You know, it meant that if you were involved with someone, you can actually have a healthy lifestyle. It didn't mean go outside and go into the bushes and the parks and so on and be reckless. That's not what it meant. You know, so that was one of my concerns about that particular message going out, is how it was rolled out.
Thank you, Jose. Does
I
anyone?
have to agree. Can I say one thing? I have to agree with Chris on the peer support. I agree that I think is a good thing to have for people that are newly infected. I found for me, having someone and meeting other people with HIV in the beginning was very important to me, to hear how they're dealing with it, you know, and living with it. So that was very powerful for me to always want to meet with other people and other women, especially, to understand what we go through and talk, you know, with what our lives are, and that's important. But to me right now, I think there's not enough education. There's still a lot of ignorance around HIV. I don't see any signs up anymore. You know, when you go out, I don't see anything like advertisements. There's a few more commercials I see on TV, but I just don't feel it's enough. And I don't feel that there's a lot of doctors that aren't very well knowledgeable about it. Like my own family doctor right now, he has given me like puffers that interact with my medications, not knowing. So there's still a lot more education that needs to be done with the healthcare system also, as well as the public. I feel I'm kind of getting a little lost track here.
Yeah.
So yeah. Go ahead, Believe.
No, it's all right. I'm just agreeing with what you are saying in terms of really a lot of peer support, which I feel you guys really with what you are doing just today, with anyone who is watching live to this, and those that are going to tune in later to watch on this, they are going to learn from you on how to live with HIV and what resilience is all about, right? And that peer support is critically important. I totally agree with what you're saying, Tracy, for sure. Go ahead if you've got something that you still want to share.
What is sad, I think, is just how COVID has taken over also, where HIV has been totally put on the back burner, because now with this COVID, it's everything COVID that's consuming the world today. So unfortunately, you know, with it being World AIDS Day tomorrow, there's not a whole lot of people that, you know, do you get what I'm saying, that are into that, they're worried about getting COVID. And I mean, even being doubly vaccinated, that you could still get COVID. I mean, it's a pretty scary thing, and it's overpowering the whole HIV and AIDS world. Honestly, that's how I feel right now. So
yeah, that's true. Thank you, Tracy, for sharing. And you know, I believe the signs of the day really has led us to where we are. And just like what you were saying was there, I think there's still more. I think in terms of ensuring that healthcare service providers have more awareness on how to interact and deal with individuals that are living with HIV when providing those services. I think it's critically important. Peer support, I think it's really important. I think, again, avenue to ensuring that people get the education and especially the mentoring of survival, something that I can tell you personally, when I was in a support group and they were laughing about, you know, the early stages when you are having all those symptoms and initial opportunistic infections, and they're talking about it as a phase of life, and that was very empowering to me in my early years. And hearing from you, each one of you, and to those that are on this webinar today, I think you'll be able to learn from these guys in terms of how they have lived with HIV, and I think the cry that they have in terms of really the education that has to be done in addressing stigma, the misconceptions surrounding HIV and AIDS, and I think the ongoing advocacy that have to be done in terms of increasing accessibility of HIV and AIDS treatments, and also really advocacy around the fact that I am on treatment and I cannot infect another person when I have sex, doesn't dismiss the fact that I have to protect myself from getting other transmittable diseases like gonorrhea and so on. So there's that ongoing, I think, knowledge quest that has to be done as well. And definitely, I think for you guys who have lived for HIV for a long time, for sure, I think it's really a lot of work on us and a bit on us to mentor and groom upcoming activists. The passion that I'm hearing that you are having, that it can actually be continued. So I would want to unless if anyone has got any question, what I wanted to do was to go to question number 5. And I think, again, Tracy had already started talking about what needs to be done, in terms of today for people living with HIV and AIDS. And so I want to ask, what is needed today for people living with HIV and AIDS? Really looking at, I think, maybe what you feel are things that are impacting people living with HIV and AIDS today. What has changed in terms of medications, again, sort of support from the agencies. Was there, I think you touched on that in terms of, healthcare providers really not being knowledgeable much, even when they are giving vaccinating or flu shot, them being scared or being in a hole and they are asking you a question, you are going for consultation and they are doing their triage. They're like, what other disease are you living with? I mean, like the whole confidentiality and privacy issues, right? Yes. So what is it that is still needed today for people living with HIV? That you feel you guys still needs to be addressed. I know that we are living in a COVID era, for sure, and issues to do with individuals being vaccinated is very important. So, but I want to hear from you. What is needed today for people living with HIV? Let me hear from some. Chris, I don't want to put anyone on the spotlight. You've been very quiet there a lot, man. I know you have a lot to share.
Yeah, all right. I'll go first. Yeah, this is definitely an interesting question. Yeah, I know. I'm trying to put myself as if I was diagnosed with HIV today or very recently, and yeah, I know there's a lot of services that are definitely available to somebody newly diagnosed. I think it's really important for somebody newly diagnosed to be properly connected with an ASO, an AIDS service organization, someplace like the AIDS Network. That is definitely important. And I think healthcare providers really need to understand how necessary that is. The supports, definitely access to counseling, and this should be a seamless process. There shouldn't be gaps in there for people to fall through. Getting an HIV diagnosis is very challenging. It definitely provides mental health potential for mental health issues. Definitely depression, and possibly substance abuse some all that type of stuff. Definitely the supports, the immediate supports when somebody is diagnosed. They should not be walking a doctor's office after getting a diagnosis without the support immediately available. Agency supports. I don't know. I'm a grateful member of the AIDS Network. I know they are always looking for creative ways to engage with the community. That's an ongoing challenge, trying to reach specific communities. They do an awesome job. They have so many services available for specific communities. I think one of the biggest challenges, myself, I live in Norfolk County, so that's more of a rural area. I'm not right in the city of Hamilton. So yeah, it's making sure that services are brought to communities that people live in, especially rural communities. And I know that those type of services have definitely expanded over the past several years for like Brant, Haldeman, and Norfolk. And it was a process to get services. And it was a process the AIDS Network went through to get services out to people in rural communities. And yeah, it's just very important. And that kind of ties in with the connection aspect. It's very important for people in a rural area to get connected and get to healthcare providers. Yeah, you can't get an HIV practitioner in a rural community most of the times. You have to go to the bigger centers, Simcoe, or in my case, my doctor is in Toronto. So it's just getting to Toronto. I do have a vehicle today, but in the past it was a challenge. It was an all-day trip to Toronto for a medical appointment. So, yeah, as far as what has changed since the early days of medications, definitely the efficacy of the medications and the fact that, yeah, there's one pill a day treatments. I know there's trials for monthly injections. So when it comes to the health aspect, we've made great strides, and research and development definitely still have to be an ongoing process. Ultimately, to finding a cure, like that's the ultimate end goal, hopefully. So yeah, I'll let somebody else speak on this.
Great, thank you so much. Thank you so much, Chris. Really valid points, I think, on what is needed today for people living with HIV. Networking and connectivity, I think, is a critical component in terms of living with HIV that needs to continue to be done, especially in the rural communities, in the communities that are not close to the city. So thank you so much for sharing that. Does anyone else have maybe a point? I'm looking at our time. We still there. Any inputs? Tracy, April?
I believe that more motivational speakers and that should be placed in like high schools and stuff, teaching the young ones and newly like teenagers that are going into high school about living with HIV and AIDS. Just more motivational speaking, and that should be done now to like high schools and that, because not everybody knows what it's like to live with HIV or have AIDS. And back then, like myself, I had been discriminated a lot. And I mean, even now, like my biggest issue right now is being classified as a sex offender for life, which I shouldn't. I'm not a sex offender, and I shouldn't be classified as that. And I think that needs to be addressed as well, because if someone like me was charged with not disclosing my status and taking a deal of, either going to trial, spending 10 years in prison, or taking a plea, and being called a sex offender for life. You know, people need to be addressed like, that's not me. And so I think more motivational speaking in the community and high schools and teaching the young teens what it's like living with HIV. That's my input
Yeah,
on that.
I'm gonna hop in there and definitely let them know that it can happen to them, because the way that young people are, as you know, from being young ourselves, think it won't happen to me. You know, I've talked to a lot of teenagers where they've had unprotected sex, and some of them unfortunately have gotten positive over the years. And honestly, they thought it couldn't happen to them. I did. I thought it couldn't happen to me either. I thought it was just a gay person's disease. That's what I thought in the beginning. Like, and I didn't know that drug addicts could get it also, you know, or the heterosexual people can get it also. You know, I honestly really was ignorant about it and did things where I thought like, oh, it won't happen to me, you know, and risk myself. So, I mean, yes, definitely. Then there's also back with healthcare again. Like, I think with getting older and living with HIV, there's got to be a lot more education around that and dealing, like, you know, I've gone through menopause right now, and I've had a lot of health issues with down there, my female parts. And I just don't feel I have a right over my own body with my doctor. You know, I've asked him to like give me a partial hysterectomy just because I've had very many scares of cancer down there and dysplasia and stuff, and he's removed stuff, and you know, and it's like, just for, you know, give me a partial hysterectomy, and he's like, he refuses. He says, oh, we'll just watch it, we'll keep an eye on it, you know, which I feel is not very fair. So I mean, it's time for me to look for a female doctor, I think, and somebody that's more can understand female stuff, you know.
And I feel that you have the right to choose what you want to done with your body, Tracy. No doctor should ever say no to what you want done with your body.
Exactly.
So,
and I mean, and I always said, even if it comes to the end, if I did get really sick and I couldn't take care of myself, you know, like if I chose to end my life, then let me do that. That comes into euthanasia. I strongly feel, and I talk to my family members saying, you know, if it ever comes and I get sick and I'm on my deathbed and I can't take care of myself, please, like, help me to, like, just, and I don't want to be anybody's burden.
yeah.
No, I don't want to, you know, I just don't want to do that to my family, you know, so I want to have that choice to take
It's
care
your
of
life and your choice.
exactly.
Exactly.
For all of us, right?
Mhm.
Thank you so much, Tracy, for sharing. I think one of the what I'm hearing, what the key issues that you highlighted there is the right to sexual reproductive health. I think it has been a plea for women for a very long time, especially women living with HIV. Something that I'm greatly passionate about, that I will never, and I always say this to women, I'll never, because I'm a man, I can never say I understand it because I don't wear those shoes, but I can only imagine what it is like for women, from the commodifications of having to buy pads for menstrual cycle, and they have to deal with all those barriers, and it comes in with a lot of challenges. I think that really requires supports that have to go to women, especially having, you know, living with HIV. And April, you are definitely right. Really, criminalization of HIV and having to live with that brand that you are an offender because, you know, you're a person living with HIV. It's something that I think we don't have to really live with and continue to express. And I think these are some of the things that are really key in terms of what people living with HIV and AIDS would really need: the ongoing education, the space, the rights, the freedoms. I think really ongoing, continued. And I think for our young people, really, as Tracy is saying, to appreciate that. Don't remove yourself from, you know what, it happened to you, it might never happen to me, right? Things keep on evolving. And rightfully, as you have said, Chris, earlier on, I think creativity in terms of reaching out. I think, that it has to be continued to be done, right? So that, we reach out not only in the rural communities, but reach out to young people in continued creative ways. And I think as people living with HIV, these are some of the things that we keep on worrying about as things that we really needed to be done, and more trainings and awareness, April, motivational speaking in schools for these young folks, and in colleges too, right? There's a lot of risk taking these days, man. A lot of adrenaline among these young people wanting to have sex, and so you start to wonder whether protection is actually being used, right? Thank you guys for sharing and all your inputs on this question. So anyone who has got a last thing to say in terms of what needs to be, what's needed today for people living with HIV before we go to the last question?
I would just like to jump in here because I want to sort of jump on what April was saying, the criminalization of HIV and the work that was being done to decriminalize HIV. And this is something, when we talk about complacent and so on, just where it's at, we have a disease that has been criminalized. And as such, people have paid the price of that. But the science that we have today does not support criminalization of HIV. And I know earlier on, there was a lot of work, especially from HALCO in Toronto, that they were doing to try to decriminalize the disease. But again, where's that at? Like, there's no more sort of advocacy around that. Like, I haven't heard anything for many years about where that has gone. So again, it comes back to the work that had been started just seemed to always fall on the wayside. But yet the policies and laws that have been put into place are still there. The science is advanced enough to say there is absolutely no need to have a law that criminalizes HIV.
Great, great stuff. I know that the AIDS Network in Hamilton, they're really doing amazing work to reach out, and there's ongoing efforts to do the best that they can to reach out to folks in terms of supports, and that's something that I'm really amazing. One of the things that I said, I want to be part of this organization, in just looking at policies and what they do, and it's amazing. So if you are staying within the greater Hamilton area, I want you to know that we have an amazing organization downtown that is willing, and I know that outreach is really expanding to reach out to folks, especially during this COVID time. So you can give them a call. Jillian, I think if you've got a number there for the AIDS Network, just put it there on the chat so that people might be able to reach out. I mean, if they need support as much as possible for people living with HIV.
And
thank you so much, guys, for
the women's group that they run there is also great at the AIDS Network. I'm enjoying it.
I'm enjoying it.
Connected, yeah. So I'm happy to be a part of it, definitely.
Awesome.
I just have to say that I found that after being incarcerated and after getting released, and the law kicked in place about disclosing your status to your partners, if your viral load was undetectable, you don't have to disclose your status. I haven't heard anything from the legal side or any criminalization, anything after my involvement of being incarcerated and stuff. So I'm just wondering about HALCO and the criminalization, and because I know that I still have to check in every year with the police, being a registered sex offender for life. So I'm just wondering, where has that all gone, in my point of view?
Yeah. And I certainly believe that, if if it is decriminalized, a lot of the cases that have been presented in the court system will have to be reviewed, especially if the individual who had been arrested and charged was not responsible or have infected anybody. You know, so if your charge, I believe, if your charge was simply because you did not disclose without having infected someone, I mean, I'm certain that once the the condition of decriminalizing HIV is in place, that those things are going to be reviewed, because you can't label somebody something when they actually haven't committed a crime. You know.
Well, there's a lot. I think there's really a lot to that, right? So you have done something and you didn't know, right? And it's beyond your control. There's no systems in place. I think really HIV criminalization is a really huge issue. And I know that ALCO, in collaboration with AIDS service organizations like the AIDS Network, they've been doing some periodic informational sessions with that regard, and I think maybe updates on what they are doing to address the issue. And so it's something that I think that's ongoing. I think for April, I think, and everyone who is watching this, I don't know, Gillian, if you can just type in the HALCO website there, you can go to the HALCO website, touch base with them in terms of updates on
Give me a second.
Decriminalization law.
I would just like to know if I am able to get a pardon in 10 years to remove this sex offender off my status. That's what I want to know. So,
Yeah, you would think that you could, I mean, I don't know the circumstances, but I think that I mean, it's money that's spent also. I mean, but I mean, it's worth it, I guess, to try to do that. And I wanted to ask you, April, in retrospect to that, it sounds like you just agreed to it because you didn't want to go through the system of what the sentencing would be.
it was either take the deal of 3 years probation and being released, or going to judge trial and jury with the judge. And if I was found guilty, then I would have spent 10 years in prison. So I had to either take the choice of, getting out to be with my son or going to trial. And that's where they left me at.
And you didn't know that you'd be a registered sex offender though either. They didn't tell you that part.
No.
Of it.
No.
That's horrible.
Yeah. So
sorry.
Yeah, it's all right. I think the takeaway from this is that there's still really need for education, and I think on the part of the law to recognize, I think, the rights of people living with HIV in terms of decriminalizing HIV, because it happens to us, we don't know, like we had no control over it, and we don't know. And I think it is the onus of the law to sort of look into that, into the rights. And like I see there's a link there for HALCO. Definitely to touch base with them. I think if anyone has got same experiences as April has gone through, I would encourage you to touch base with the HALCO with regards to how these issues can be addressed.
Can I put something in there? So first, which is really scary is that for somebody newly diagnosed and then not disclosing, to know that maybe possibly, what if it's a bad toxic situation and that person can turn around and do that to you, to charge you? Do you know what I'm saying? Like where they were knowledgeable in some way, but they turn around. I mean, that's just a scary thought that I would have, especially being young and having sex with people, like I just, yeah. I don't know what I just, yeah.
That's true. And you know what? We have a right to have sex just like everybody else. And with the U is close to you, that was they was talking about. I think we have an opportunity here and check with the awareness, the onus that is on everybody when you're having sex, to protect yourself, so that it doesn't really become a burden of a person living with HIV only. It doesn't become a burden to us. And to folks that are newly diagnosed, I think this is important to know that you have the right to protect yourself, and you have the right to get the other persons to be accountable to themselves in terms of protecting themselves. And for sure, I think ongoing working with our networks and our peers as much as possible to ensure that really there's ongoing support. So I think this really paves way to the sixth question that I would have loved to ask you. And this is our last question in terms of what you hope for in the future. And as we look at this, as we talk about what is needed today for people living with HIV is for them to live a life free from being criminalized, that there are people living with HIV living from fear that because of that they're HIV positive and they're women and because they've been substance abusers, so therefore they should be criminalized. I think it's something that we desire that happens to people living with HIV. And I'm very grateful to all of you guys for sharing your experience with regards this. I think it's an eye opener to someone living with HIV out there to be able to step out and seek support as much as possible when it comes to this issue.
Can you just excuse me for a sec? Sorry.
Okay. Okay, so let's go on to, unless if anyone else has got something to say, what I wanted to do now is for us to get into our last question. Each one of us really to have an opportunity to discuss what it is that you hope for the future, right? In terms of agency support. I think, Jose, you have talked so much about the research, the education, and the accountability when it comes to healthcare service providers. And in terms of medication, some of you were expressing that you had to take so many medications initially on the early days of your treatment. I remember taking about 16 medications when I had TB when I was in Africa before I came to Canada, and I would vomit, and I would still want to take, I have to take them again. If I don't take them, I wouldn't address the TB that was within me, right? So I had to take them over and over and over again. And so here we are. And I'm asking now, you again, what is it that you, I think as individuals, would hope for in the future? What would you want to see, right? In terms of agency support, in terms of research on HIV and AIDS, especially during this COVID era that we are living?
I'll go first. I think for me would be a continuum of seeing that we are working on getting a cure. I think everybody wants that. It may not happen in my lifetime, but I want to continually see that sort of work being done. I want to see that there are provisions that look at what is needed for a person with HIV to live a relatively comfortable, good life, especially in our country, because the resources are there. Access to housing, access to treatment, access to adequate medical care, because this is a lifelong disease. There's a point in our lives, like for example, especially for people who had been HIV positive in the earlier days, where the fortitude to sort of make, a career that would secure their future wasn't in the cards for them. And they have to take alternatives in which, now that we are living longer and surviving, we need to have certain elements in place, whether it's housing in place, whether it's adequate income in place, and still be able to access the necessary healthcare that we need. For me, as a person who's aging, who's been living with HIV for a very long time, those are the elements for me that applies to me out of the greater scheme of things, because I've been there from the beginning, and I'll probably be still here, at the end of it. So it's really about When an HIV person needs to get housing, they have access to it. When they need a support income, they have that. When they need the medical care and services, that is into place. Those are the three major elements for me, I believe, should be in place for the future.
Thank you so much, Jose. Jose, for the future, he hopes increased access to housing. Talking about social determinants of health, really a critical component in addressing some of those social determinants of health for people living with HIV. Housing accessibility, income supports, very, very important components. What do you think we would hope for in the future? April, you just missed Jose there. He was talking about what he hopes for the future, and he highlighted the fact that housing, I think, is a critical component. Accessibility to supports, I think it's something that needs to be continued to be there.
I heard what he said.
Awesome.
Yeah.
I thought you'd gone very far. So.
I
Okay.
just want to jump in there and add, and also access to counseling, like easily to get counseling with no interruptions, no gaps, like Chris was saying earlier.
Yeah.
That's also definitely something that would be good for the future.
Awesome. Access to counseling.
I hope for that people living with HIV can enter a seamless system. I did use the term seamless before. There are a lot of barriers that still need to be overcome. Inclusivity, connection. People, any human being needs the sense of connection, and COVID has definitely complicated the connection aspect of things. It is so important. So a seamless system that it connects people, that involves people, that advocates for people, and really just love. Supports that to make people feel loved and part of something. That's what I really hope for the future.
Thank you so much, Chris. Seamless system. We're talking about really the issue of breaking down systematic barriers in accessing treatments, in accessing supports. That's really amazing. And you're talking about really here, we're talking about anti-oppression, where everybody else feels safe and included in spaces normally they would not be in, and this whole inclusivity issues that you're talking about, really meaningful way. I think ongoing integration as well as involvement, meaningful involvement that are empowering involvements of people living with HIV, meaningful involvements for people like Tracy and April and Jose to continue to be able to be the mentors, right, and be the champions. That is really needed, and being able to sort of guide and hand over those some of those passions to the younger generations in terms of addressing HIV and AIDS. Thank you so much, Chris, for those inputs. Let me hear from you, ladies, anyone, on what you hope for the future.
I just hope the future for the younger generation again to be, my grandkids to be healthy and safe, and all my friends and their children. It's the younger people that are growing up in this world that we live in, to take care of themselves and to have access to all these good things to continuing on.
Same here.
Awesome. Awesome stuff. Well, Jose, would you have anything to add on what you hope for the future?
Yes. If I'm doing anything, pay me for it.
There you go.
Because on a serious note, I think the wealth of experience and knowledge that comes with a person with HIV,
Yep.
it's valuable knowledge. Whether we are asked to participate in, particularly if we are asked to participate in research projects,
Yep.
because without our contribution, they have nothing. Researchers have nothing. So they need us in order to formulate their thesis, to formulate their ideas, to formulate their theories. They need people like us. I think they need to appreciate our contributions and not just given a conclusion that is not followed through. So when you make recommendations after you've taken our knowledge, implement those recommendations and make them work. That's all.
That's a very valid point there that you are making there. Was there meaningful involvement that goes beyond just having you being there and being involved, but also that you really involve being remunerated for the inputs that you are providing. It's part of engagement, right? One of the things that have happened for a very long time is people living with HIV being asked to participate, maybe as a token and not being paid for that by researchers. So really it's asking what people living with HIV, who have lived with HIV that you are seeing today, are asking that we hope for the future and ongoing, support towards people living with HIV when they speak, when they input their knowledges and ideas, that they be remunerated for that in a meaningful way, for the engagement really to be meaningful. Anything that you guys still have that lingers that you would want to say on the 6 questions that we have asked that you think you still need to input, that you have?
No, I'm good.
Awesome. Well, I mean, on that note, I definitely would want to thank you so much for sharing rich experiences of living with HIV and being long-term survivors, and your unique experiences and what you have gone through and the things that you hope could be addressed. I think as we celebrate and get into World AIDS Day tomorrow, it's something that we need to think about continuously in terms of our desires to address HIV, avoid it to those that are not infected, that they don't get affected, and for those that are newly diagnosed who have got it, to have hope that it's something that you can live with. I'm sure you can see Jose, you can see April, Chris, Tracy, you can look at me, and you see us surviving. We are okay, and we love, despite that we've gone through all those difficult circumstances, but we are here, and so can you. Yeah. So, ladies and gentlemen, I would like to thank you so much for sharing your experiences. I definitely would want Gillian to come back now because I'm going to hand this over to him to wrap up. I know she was somewhere hiding there. Gillian, so what do you think? I mean, I'm so deeply touched and I feel very honored to be among these great women and men sharing their very unique experiences. I do have mine. Yeah.
Yeah, thank you so much, Believe. I feel the same way. This has been such a powerful conversation. When I think Jose was saying when he was speaking earlier and mentioning the huge number of people, I love it. Happy holidays. You were mentioning before the loss that the HIV community has experienced, the massive number of people that we've lost. And I was thinking when you said that, when we get to numbers that big, that we can't process it, right? Like right. It doesn't mean something. Yeah. But I think that, and I was thinking, how do we personalize that? And I think that it's conversations just like this one today that people need to hear, that personalize the experience of living with HIV and help people to understand the impact it has on our lives. So I'm just so grateful to all of you. There's comments coming in the chat from people sharing how I'm feeling as well, saying thank you for putting yourselves out there, for sharing your experiences, for sharing your stories. It's so valuable, and I know for so many people watching live, and for people who will watch this recording afterwards as well, that they will learn and grow from hearing your stories. So believe you've done an amazing job facilitating. I can't imagine anyone could have done better. That was wonderful. And Jose and April and Tracy and Chris, thank you so much for sharing your stories with us. I included the link to the documentary April had mentioned in the chat, so people can go and take a look at that afterwards. And also don't forget to tune in for the World AIDS Day Vigil tomorrow evening at 6 o'clock. So with that, I think we will end off, and thank you everyone so much for joining us today.
Thank you.
Thank you.
I appreciate being here. Have a great weekend, people.
Have a great